Drugs. It's a word that we've all heard before, but do we really know what they are? They are often talked about in their use among high schoolers, and according to the Monitoring the Future study from the University of Michigan, as of 2017, around 13.3% of 12th graders reported past year use of illegal drugs. For this presentation, I hope to explain more about this topic while using the extensive research I have collected. I've decided to look into what psychoactive drugs are, how they affect our health, their significance among college students, and some common misconceptions surrounding them. But before we dive in, I would like to look at some specific terms first. There are so many terms commonly used when talking about drugs and their use that it can become quite difficult to determine their specific meaning. I've managed to track down the definitions for these terms from the textbook Drug Society and Human Behavior. A drug is defined as any substance, natural or artificial, other than food, that by its chemical nature alters the structure or function in a living organism. The term psychoactive is used to describe drugs that have their main effects on the central nervous system in the body. The central nervous system is the brain and the spinal cord. So a psychoactive drug, then, would be any substance that chemically alters the natural effects of the central nervous system. Typically, when we talk about drugs, we use the words abuse and addiction interchangeably, but they are, in fact, different. Drug abuse is the use of a substance in a matter, amounts, or situations such that the drug use causes problems or greatly increases the chances of problems occurring. Substance addiction, on the other hand, is defined as when individuals struggle to control their use and have suffered serious negative consequences from that use. Another important term involving psychoactive drugs is that of drug misuse. Drug misuse is the use of prescribed drugs in greater amounts than or for purposes other than those prescribed by a medical practitioner. Once an individual uses a drug so frequently and consistently that it would be difficult for the person to get along without using the drug is when they have developed drug dependence. Drug dependence can either be psychological, involving craving, or physical. Physical dependence is also known as withdrawal syndrome, which is a set of symptoms that occur after someone stops taking a drug. Another key term associated with psychoactive drug use is that of tolerance. Tolerance is the reduced effectiveness of a drug after repeated administration, and it's only overcome by increasing the dose of the drug. That means that the more a person uses a drug, the less effective it gets. So, why do people want to use drugs? Most humans like to feel good. We tend to seek out pleasure, and psychoactive drugs can create this within our brains. But this is not the only reason that people may use drugs. According to an article written by A.C. Parrott, quote, herbal preparations are taken for their pro-health properties, sedative compounds for their feelings of relaxation, and stimulant drugs for excitement and euphoria. People tend to take drugs because they want to experience an altered state, and they may want to escape from the normal day-to-day lives. They also might use drugs because they want to identify with a deviant subculture. They want to do things that society doesn't approve of. They try to seek attention with their rebellious behavior, and the reinforcing properties of the drugs increases the chance that they will continue using. Their past experiences with the substance then becomes very important in motivating them to use again. But it's also important to realize that drug use is not abuse. There are plenty of recreational users that use substances and do not abuse it or show dependence to it. They use drugs casually and seem to have no problems controlling their use. Psychoactive drugs are usually classified according to their effects on the user, with the main focus being on the psychological effects. These drugs are then grouped together based on these effects. The main types are stimulants, depressants, opioids, hallucinogens, psychotherapeutics, cannabinoids, and nicotine. Stimulant drugs produce wakefulness and energy. Some examples include amphetamines like Ritalin, Adderall, and amphetamines and methamphetamines and cocaine. Depressant drugs produce relaxation and disinhibition. Some examples include alcohol, barbiturates like phenobarbital, benzodiazepines like Librium, Valium, and Rohypnol, and non-benzodiazepines like Ambien, Sonata, and Lunesta. Opioids are pain-killing drugs that produce a relaxed, dreamlike state. Some examples include morphine, codeine, heroin, oxycodone, and hydrocodone. Hallucinogens produce altered perceptions with unusual visual sensations. Examples include LSD, psilocybin, ayahuasca, peyote, MDMA, and PCP. Psychotherapeutic drugs are used to control mental problems. They include antipsychotics like Abilify and antidepressants like Prozac. Cannabinoids and nicotine don't fit into any of these classes, so they are listed separately. Cannabinoids include marijuana. Often we see that psychoactive drugs are being mentioned in the news, and they seem to be presented as a major issue in today's society, but that is not true. Psychoactive drugs have been used for thousands of years. In fact, according to the textbook Drug Society and Human Behavior, most of our drugs either come from plants or are chemically created from these plant substances. A long time ago, some of these plants produced new chemicals that allowed them to be more likely to reproduce and less likely to be eaten. If these plants are eaten by humans in controlled doses, then they can produce interesting or useful effects. In early cultures, medicine men or women were the people who knew about the plants and how to use them properly. Until the early 1900s, there was relatively few laws created by the U.S. government to control or regulate the use of drugs. There were no laws that would require a drug to be effective, and no law requiring manufacturers to say what percentage of psychoactive substance was in their product. These patent medicines often had false therapeutic claims and contained habit-forming drug content. Another issue around this time period was that drug use was being associated with the low-class people of different races. Opium was brought to the United States by Chinese workers, and the practice of opium smoking spread very quickly, which led to the racist laws preventing its use. Cocaine, which was in many products such as Coca-Cola, became widespread in its use among African Americans in the South. It was supposedly responsible for the violent crimes being committed by the lower class, so racist laws were created to prevent its use. This pattern of drug use by other races and misleading patent medicines led to a series of drug regulation laws. In 1906, the Pure Food and Drugs Act stopped the misbranding of drugs. Now the labels are required to say which psychoactive substance are in them. The 1914 Harrison Act, according to the textbook Drug Society and Human Behavior, required those who produce, import, manufacture, compound, deal in, dispense, or give away drugs to register and pay a special tax. The 18th Amendment was crucial for creating the idea that the only way to cure drug dependence was to prevent the user from having access to the drug. This idea is the main conflict between just putting users in jail or taking them to rehabilitation. The people of the 1930s were angry at the government because of prohibition, and they wanted a better government program, so the Bureau of Narcotics was created. This bureau helped to create the 1938 Food, Drug, and Cosmetic Act, which required that drugs be tested for toxicity before being put out on the market. This law made the FDA into a gatekeeper for drugs going onto the market. In the early 1960s, a drug called thalidomide was given quite frequently to pregnant women as a treatment for morning sickness, but it was later found to be a serious teratogen that caused birth defects. This disaster led to the 1962 Kiefer-Harris Amendments, which required approval before testing drugs on humans, and also required that drugs be effective for what is mentioned on their label. According to an article from the British Journal of Addiction, the introduction of antidepressants in the late 1950s and benzodiazepines in the early 1960s started an era of increasingly prescribed psychoactive drugs by doctors. In the 1970s, doctors were getting concerned about their widespread use and abuse, and they began to realize that these drugs had a high risk for dependency and overdose death. These psychoactive drugs were often being prescribed inappropriately for personal and social problems. This increase in prescription drugs and problems relating to them led the government to create the 1970s Comprehensive Drug Abuse Prevention and Control Act. This act essentially got rid of all past laws relating to drugs and updated them. It also created the Drug Enforcement Administration, or the DEA. The DEA created 5 schedules of controlled substances and organized them based on their potential for abuse, accepted medical use, and risk for dependence. After having learned so much already about psychoactive drugs, the new question arises. How do these psychoactive drugs affect our health? Most effects of psychoactive drugs depend on the user's expectations. An experienced user typically reacts differently than a new user, for example, showing less disruption of cognitive ability while trying to drive after smoking marijuana. Experienced users also report more positive effects of a drug because of their prior use. New users' experiences with drugs can change based on their knowledge and expectations of what should happen. When users take a drug, they are typically seeking out one specific effect. It's important to realize that every psychoactive drug acts on multiple sites in both the brain and other organs, and can create multiple effects. For example, the alertness that comes from taking a stimulant like cocaine also significantly raises the heart rate. Each of these psychoactive drugs work by influencing the levels of neurotransmitters in the brain to either make the neuron send the signal or make it not send the signal to the rest of the nervous system. This signal is what creates the effect of the drug. Each drug typically affects multiple neurotransmitters, and as a result, it has been very difficult to completely understand the effects of every psychoactive drug. Some of the most common neurotransmitters include dopamine, serotonin, GABA, acetylcholine, endorphins, norepinephrine, and glutamate. Psychoactive drugs can have very different effects based on the amount of drug that is taken. The size of the dose, whether large or small, can seriously affect how much of the substance reaches the brain of the user. The frequency of taking the substance can also seriously impact the drug's effects. The more you take it, the longer the effects. The method of taking the drug can also have different effects. The speed at which the drug gets to the brain creates different effects. The method of taking the drug is also known as the route of administration. There are 6 main routes of administration for drugs: oral administration, insufflation, intravenous injection, subcutaneous, and intramuscular injection and inhalation. Oral administration is taking a drug through the mouth, and it typically takes a long time before an effect. Insufflation is the snorting or sniffing of drugs through the nose, and because the drug can easily get to the bloodstream, the effects are very fast. An example of insufflation would be snorting powder cocaine. Intravenous injection is putting the drug directly into the bloodstream by using a needle, and it tends to have very fast effects. An example of this would be a user injecting heroin. Subcutaneous injection is injecting the drug under the skin, and its effects are on the slower side. Intramuscular injection is injecting the drug directly into a muscle, and the muscles have a better blood supply than the skin, so it has faster effects. Inhalation is a very fast and efficient way to deliver a drug to the brain. The substance enters the lungs very quickly and gets picked up by the bloodstream and enters the brain. Once a drug is taken, the effects also depend on how that substance is absorbed by the body and eliminated by the body. For example, smoking marijuana results in rapid absorption in the bloodstream, and peak effects occur after 10 minutes, while eating it results in poor absorption in the gastrointestinal tract, and the peak effects occur only after 60 minutes. Marijuana also takes a full 2 to 3 weeks before it's completely eliminated from the body. The potency of a drug can also determine the effects. The potency is the amount of drug needed to create an effect. A drug like LSD is one of the most potent drugs, and so a user only needs a very small amount for an effect. Side effects of taking psychoactive drugs can also affect a user's experience and health. Side effects are the unintended effects that accompany drug use. For example, when a person has schizophrenia, they usually take prescription medication to control their psychotic symptoms. But the atypical antipsychotics they take have the side effects of weight gain, increased risk of diabetes, and a deadly suppression of the creation of white blood cells. When taking psychoactive drugs, there is a certain level between the therapeutic effect of the substance and the toxic reaction. Even the normal effect of a drug can seriously impact a user's health. For example, marijuana users have some quite severe short-term cognitive effects on their health. They tend to have slower cognitive processing, disrupted short-term memory, loss of concentration, and a lack of inhibitory control. Psychoactive drugs can produce dangerous or potentially dangerous consequences. This is toxicity. There is acute or immediate toxicity and chronic or long-lasting toxicity. An example of acute toxicity would be taking an overdose of prescription opioid painkillers that slows the respiration rate to dangerously low levels. An example of chronic toxicity is the paranoid psychosis that can sometimes result from long-term amphetamine use. I'm going to pick up this video on the next video because this program has a limit of 15 minutes.